Hi everyone, my name is Dinesh Thirasena and I'm a consultant in sports medicine. I use ultrasound regularly in my clinical practice and I wanted to share with you some of the additional tools that you might find useful when you're doing your imaging. By the end of this video, you should be able to apply these in your clinical practice and hopefully they'll be helpful to you when you're assessing patients. As mentioned in the last video, this is the machine that's available to me in the clinic. It's the Logic S7 XD Clear. While your machine might be different to this, it's important to be aware of the different functions and the layouts and familiarize yourself with them so that it helps you while you're performing your scans. The first thing that we're going to talk about is the time gain compensation. You might remember in the previous video I mentioned about overall gain. The time gain is an additional step whereby you can adjust the gain from different depths on the image. It allows you to make deeper structures brighter while maintaining the signal from the superficial areas and vice versa. It allows for a more consistent brightness throughout the image, and you basically slide the switch along to alter the gain. Even if you do this, you can adjust the overall gain to make the whole image brighter or darker. The next thing to consider is the power Doppler. Power Doppler looks for blood flow in an area, and it's basically based on the Doppler concept, where sound gets louder as it comes towards you and quieter as it moves away. In this situation, that's the same that happens, but it's related to blood flow. In the image that we have on the left, you can see the Achilles tendon, and what we're looking for here is neovascularization using the power flow, and it's a sign of tendinopathy. In the S7, you basically push the power flow button to turn it on and off. Another tool that I find quite useful in clinical practice is the split screen mode. Maybe not every machine has this, but the S7 certainly does. And what it's useful for in MSK is comparing one side to the other, particularly if there is pathology on one side and the other side remains asymptomatic. In the images on the below, we're looking at my wrist joints, so my left and right, and it allows a head-to-head comparison. One useful tip is to make sure that you mark the areas so that at least you have a fair comparison anatomically. The next thing to consider is the panorama. The panoramic view allows for a widescreen or larger view of a particular structure. On the S7, it's described as the Logic view. Now, depending on your experience, this may require a steady hand and an assistant to help start and stop the panoramic recording. It's particularly useful in musculoskeletal imaging for longer structures such as tendons, such as here we have the Achilles, or muscles, where we may be looking for tears and so forth. The last tool to talk about is elastography. Now, elastography is used to assess the stiffness of tissue. While it's more commonly used in breast or liver scanning when assessing lumps or tumors, it can be used in musculoskeletal scanning for structures such as the patella or Achilles tendon or even the muscle, but when you're looking for chronic disease or maybe even sarcopenia. Loss or excessive stiffness in the tissue could imply pathology within this area. As mentioned in the previous video, it's important to optimize your images, and this depends on selecting the correct transducer, using the correct settings, adjusting your gain, your focus, your frequency, and your depth according to the area that you're scanning. These are all considered essential controls, and that if you want to learn more, please have a look at the previous video. I hope you found this video useful. I certainly enjoyed making it, and if you did, please give me a thumbs up down below.